NREMT Exam Prep Emergency Medical Technician Practice Test, 25 Most Asked Questions. Question 1. A 45-year-old male is found unresponsive with snoring respirations. What is your first action? Apply high-flow oxygen, insert an OPA, perform a head tilt chin lift, suction the airway. Snoring is a sign of upper airway obstruction by the tongue. The first step is to open the airway using a manual maneuver. Question 2. Which of the following is a sign of compensated shock? Decreased blood pressure, delayed capillary refill, increased heart rate, irregular pulse. In compensated shock, the body maintains BP by increasing HR and peripheral vasoconstriction. Question 3. What is the standard treatment for a patient with a sucking chest wound? Occlusive dressing taped on 3 sides. Occlusive dressing taped on 4 sides. Bulky dressing. CPAP. A 3-sided occlusive dressing allows air to escape the pleural space while preventing it from entering. Question 4. Which rhythm is shockable by an AED? Asystole. Ventricular fibrillation. P. Normal sinus rhythm. AEDs are designed to recognize and shock VF and pulseless VT. Question 5. A patient presents with cool, clammy skin and a rapid thready pulse after a motor vehicle accident. You suspect septic shock, hypovolemic shock, neurogenic shock, anaphylactic shock. Tachycardia and cool skin in trauma suggest blood loss. Question 6. What is the goal of the primary assessment? To find and treat life threats, to obtain a full set of vitals, to determine the mechanism of injury, to perform a head-to-toe exam. The primary assessment focuses on airway, breathing, and circulation. Question 7. In an adult, a respiratory rate of 8 breaths per minute is considered normal, tachypneic, inadequate, hyperventilating. Normal adult respiratory rate is 12 to 20 bpm. 8 is too slow to maintain adequate oxygenation. Question 8. A patient with a suspected spinal injury should have their airway opened using head tilt chin lift, jaw thrust maneuver, OPA insertion, suctioning. The jaw thrust maneuver is used to open the airway without moving the cervical spine. Question 9. During CPR, the compression to ventilation ratio for a single rescuer on an infant is 15:2, 30:2, 5:1, 3:1. For single rescuer adult, child, and infant, the ratio is 30:2. Question 10. What is the definitive treatment for anaphylaxis? Albuterol, epinephrine, diphenhydramine, oxygen. Epinephrine is the first-line treatment to reverse bronchoconstriction and vasodilation. Question 11. A patient has a BP of 90/60 and distended neck veins after chest trauma. You suspect tension pneumothorax, hemothorax, cardiac tamponade, simple pneumothorax. Beck's triad, hypotension, JVD, muffled heart sounds, indicates cardiac tamponade. Question 12. Where should you check a pulse on an unresponsive infant? Radial, carotid, brachial, femoral. The brachial pulse is the standard site for infant pulse checks. Question 13. The golden hour refers to the time from injury to arrival at the hospital, injury to definitive surgical care, dispatch to arrival at hospital, EMS arrival to trauma center. The golden hour emphasizes the need for rapid transport to surgery for trauma patients. Question 14. Which of the following is a late sign of hypoxia? Restlessness, tachycardia, cyanosis, anxiety. Cyanosis, blue skin, occurs when oxygen saturation is significantly low. Question 15. A patient is breathing 24 times per minute with shallow depth. The best treatment is non-rebreather mask, nasal cannula, BVM ventilation, oxygen at 6L/min. Shallow breathing indicates inadequate tidal volume, requiring assisted ventilation. Question 16. When treating a chemical burn to the eye, how long should you irrigate? 5 minutes, 10 minutes, 20 minutes, until the pain stops. Eyes should be irrigated with water or saline for at least 20 minutes. Question 17. A 30-year-old female is 38 weeks pregnant and feels lightheaded when lying flat. You should place her in Trendelenburg, transport her on her left side, provide high-flow oxygen, check her blood sugar. Supine hypotensive syndrome is relieved by placing the patient on the left side to move the uterus off the vena cava. Question 18. What is the most common cause of cardiac arrest in pediatric patients? Myocardial infarction, congenital heart defect, respiratory failure, poisoning. Pediatric cardiac arrest is usually the end result of respiratory distress or failure. Question 19. Which part of the nervous system is responsible for the fight or flight response? Central nervous system, parasympathetic, sympathetic, somatic. The sympathetic nervous system triggers the stress response. Question 20. A silent me is most common in which patient population? Elderly, diabetics, athletes, children. Diabetics may not feel chest pain due to neuropathy, leading to silent MIS.